Well, hello. This is chapter 24, Professional Ethics, out of your Radiologic and Imaging Sciences and Patient Care book. This is the PowerPoint and lecture that goes along with this chapter. If we look at chapter 24, which starts on page 301, and we look at the objectives contained in this chapter, notice that it says that you should be able to explain the ethics of the radiologic technology profession, differentiate the systems of ethics, laws, and morals, explain the four-step problem-solving process of an ethical analysis, explain two sources of moral judgment that underlie ethical decision-making, identify the moral dilemmas encountered in patient relationships, also identify the moral dilemmas encountered in physician relationships and the moral dilemmas encountered with other health professionals. Recognize the values associated with ethical decision-making in the practice of radiologic technology and apply critical analysis to ethical decision-making. When they start off looking at this with the professional ethic, a professional ethic, by definition, again, those key terms are important. They start on page 301 and they continue on page 302. But they tell you that a professional ethic is a generally accepted criteria that serves to differentiate a profession from other occupations or trades. All right. According to the book, it says a publicly displayed ethical conduct of a profession embedded in a code of ethics, and it affirms the professional as an independent, autonomous, responsible decision maker. They also point out on here that it's composed of efforts and behaviors that society holds as valuable and worthy. And they reference such things as the right to privacy and dignity, right to the truth, justice, beneficence. That should be at the end of the C, but that's one word. Beneficence, compassion and caring, honesty and loyalty. So those are all values that we have, behaviors that we should abide by. And when we look, we'll look at a little bit more in depth at those right to privacy, to truth, justice, beneficence, compassion and caring, and honesty and loyalty. Those are some selected ethical principles that they reference in this chapter. They talk about laws, morals, and ethics. And when we look at that, when we look at the laws, the morals, and the ethics, if you look on page 303, they actually do a comparison of the systems of ethics, laws, and morals. And they point out that if we look at, on this slide, if we look at ethics first, it says that ethics is applied to a specific group. The control actually comes from within the group, so it's self-regulating. Again, this is on page 303. Ethics applies to a specific group. So if we talk about professional ethics for radiologic technology, the group it applies to would be radiologic technologists. Control comes from within the group, meaning that we are self-regulated. When there are issues that come up, the sanctions that are imposed are typically imposed by people that have the same qualifications as us, members in good standing with the same qualification. The enabling source that they use is the Code of Ethics. Again, that was the Code of Ethics is found in the back of your book. It is actually on page 339, and I will go ahead and put up, along with this PowerPoint, I will put up the 11 codes of ethics that there are. Look at those in the back of the book. There are only 10, and I remember I have said in other lectures that they added an 11th, and when we go over this PowerPoint, I'll actually add it towards the end and we can look at it together. But when you agree to take the registry at the end of the program, when you sign that application, you actually agree to adhere to those codes of ethics when you sign the application, meaning that once you pass it, you are bound by those codes, and any violation could have sanctions brought against you. When we look at laws, that's the second one in this table. Laws are applied to a political subdivision. The control comes from outside the group. Typically, the enabling source is legislation, and some of the sanctions or consequences for violating the laws would be fines or imprisonment. And the last one is morals. When we look at morals, that applies to individuals. The control is by your own conscience. The enabling source is typically some form of religious writing, and the sanctions are just a feelings of shame or guilt when we violate our own morals. When we look at professional ethics, notice that they point out that ethics deals with the rightness and the wrongness of an act or behavior as compared with natural reason. So when they point out professional ethics, these are things that another competent, prudent practitioner would do in the same scenario. Like ethics is the rightness and wrongness of an act or a behavior. So if someone is yelling a patient. Let's say they have an elderly patient and the patient doesn't understand them, can't really hear them, and is having a hard time. The response is not to start yelling at the patient or screaming at the patient at the top of your lungs, because you don't know why they're not understanding you. Whether it's your tone of voice is not being picked up by maybe their hearing aid or the device that they have to use them, or that they use to help better, or maybe it's an issue that they don't have their hearing aid in. Maybe something is going on with them medically, but the rightness and wrongness of an act, so yelling at a patient is never going to be considered a right act. It would always be considered wrong. And compared with natural reason, it doesn't make sense to yell at a patient because they don't understand you. It's the societal behavior defined by laws, rules, regulation, ordinances, and so on, meaning that society expects a profession to generate its own statement of acceptable and unacceptable behavior. Okay, so that code of ethics is what society expects from professional radiologic technologists when we look at that code. Professional behavior is defined by professional standards of conduct and the scope of practice. So when we look at those, the code of ethics, the standards of professional conduct, that is actually in the back of the book as well. Those practice standards, those are what a reasonable technologist would abide by, and the scope of practice. So anytime you act outside the scope of practice, basically charges could be brought against you for violating the code of ethics or violating the practice standards of our practice. And society expects professions to self-regulate based upon the ethical standard, meaning that society depends on our own form of self-regulation to keep control within the allied health field with regard to radiologic technologists. The fact that we've talked about the ALARA principle, which stands as low as reasonably achievable. Society expects that we know we're dealing with ionizing radiation, and that we work to always keep that dose to the general public, to ourselves, to coworkers, as low as reasonably achievable. We don't ever act outside that. We don't just radiate people for the heck of it. We don't just repeat images just because we feel like it to get a better image and so the radiologist is impressed with our work. There's certain things that our professional ethics dictate that we do based on a reasonably prudent practitioner. When we look at societal behavior, they reference that it's governed by laws and morals. Laws can be limiting and are not comprehensive in controlling all the possible behaviors. Laws need enforcement and authority in order to do so. They can be politically motivated and applied unequally. And morals are generally accepted customs of right living and conduct, and an individual's practice in relation to those customs. Those are some society behaviors. When we look at professional behaviors, it also says that society expects a profession through its collective members to generate its own statement of what is acceptable and unacceptable behavior. defined by two distinct documents, and that would be our Code of Ethics and our practice standards. It establishes the norms for professional conduct. Radiologic science professionals have to know the ethical and professional standards of our profession. If you're not aware of those, you would never want to become a radiologic technologist without looking at those to make sure that you will not have issue abiding by those codes and by those professional standards. When we look at the Code of Ethics, again, the ARRT adopted the Code of Ethics as well as the ASRT, and those came out of Chapter 2. Remember, the ARRT is the American Registry of Radiologic Technologists, and the ASRT is the American Society of Radiologic Technologists. Both of those organizations have adopted the ARRT's Code of Ethics. It is made up of two parts. The first part deals with behaviors that a professional should aspire to achieve. The second part, Part B, deals with mandatory rules of acceptable professional conduct. The Code of Ethics deals with professionals within the medical imaging, and we have to familiarize ourselves with the Code of Ethics. You can't claim ignorance on that and say you weren't aware, because actually before you sign the registry application, it lists for you the Code of Ethics and says that by signing you agree to abide by those, and that you cannot in the future say that you weren't made aware of them. The Code of Ethics establishes professional norms of conduct, and the codes are typically static and slow to change in order to reflect changing societal trends and values. And lastly, with regard to the Code of Ethics, the ethical codes rely heavily on behaviors that reflect professional etiquette, which anytime you're talking about etiquette, it tends to deal with manners, so professional manners, and are respectful of human values. The Code of Ethics can be too narrow and confining in defining acceptable behavior in all situations, meaning that the Code of Ethics is not complete. It's impossible to address every single scenario or situation because every patient is different, every technologist is different. So that code is narrow in that it's purposely written kind of vague so that it can be interpreted when situations come up. You can kind of pull those situations into the codes of ethics and see if it violates or adheres to that. And last, it can lead to an ethical dilemma. An ethical dilemma is basically a situation that requires moral judgment between two or more equally problem-fraught alternatives. There's two or more competing moral norms present, which creates a challenge about what to do, meaning that realistically either way would be acceptable. It just depends on what is best for that particular situation. Again, when they talk about professional etiquette, typically it has something to do with manners. If we look at it by definition, it's the manners and the attitudes generally accepted by members of a profession. So again, this whole chapter is mainly focusing on the fact that we are speaking about radiologic technologists. That group is who we're speaking about, and the professional manners and professional ethic that radiologic technologists hold at value and hold near and dear. Because remember, professional ethic is the internal control of a profession based on human values or moral principles, and etiquette has to do with manners. When they talk about an ethical dilemma, and I said there are two or more competing moral norms, it says that all professional decisions in radiologic technology and other healthcare practices involve a consideration of human value, meaning you have to consider your patient, you have to consider any abilities they have or disabilities that they have. You have to make it specific to that individual patient when you're making a decision about that patient. It can't just be a blanket decision across the board. You have to take into account who's your patient, what's going on with that patient. Any unethical behavior that is clearly wrong can be defined as an ethical outrage. If it is like screaming at a patient, for example, would be an ethical outrage. It's a gross violation of a commonly held standard of decency or human right. Let's say you have a patient that you go to give a gown and the gown doesn't fit the patient, and you decide that the fact that that gown doesn't fit them doesn't really warrant anything. Alexis, I saw that you popped in here, but this is just a recording for a lecture in the future. Okay, so when we look at unethical outrage, we said that that would be like a gross violation. And I was saying, like, let's say you had a patient that had a gown. You were giving them a gown to do an exam, and the gown didn't fit them. And they were trying to tell you that the gown didn't fit, that part of them was still exposed. And let's just say you're having a really bad day and you were annoyed and you told them, tough, it's not my fault the gown doesn't fit you. Come on out and we're doing this. That would be an ethical outrage. That would be clearly wrong behavior to potentially embarrass a patient or force a patient to come out with exposed because the gown doesn't fit them. So, I mean, that's a really, hopefully nobody would ever have done that, but I mean, that would be just off the top of my head, that would be a gross violation of a commonly held standard of decency. That would be an ethical outrage. An ethical dilemma, we said that's when the correct choice isn't clear and your personal values can actually conflict with the particular situation. Like an ethical dilemma, somebody could argue that assisted suicide is an ethical dilemma. Some might argue that if someone is suffering unnecessarily, there's really no means of improving their condition. It's just a slow, painful process, and there's no possible improvement. Then one might argue that assisted suicide is the right thing to do. Whereas someone else might argue that absolutely not, suicide is never a correct choice, regardless of the fact that, you know, there's no cure in sight, there's no improvement in sight. The other side might argue that that's not in our control. So that could be considered an ethical dilemma, where the correct choice isn't necessarily clear and that your personal values may conflict. Now, granted, if it's illegal, I'm not saying that. I mean, I know that wasn't the greatest example, but you could argue abortion would be another one. Assisted suicide, things like that would be ethical dilemmas where the correct choice isn't necessarily clear. Personal values can conflict with the situation. The patient's scenario can conflict. So that's an ethical dilemma versus an ethical outrage. Typically, ethical dilemmas require an ethical analysis. And if we look at the steps in an ethical analysis, pretty much what happens with that is you have to identify the problem. You have to come up with alternative solutions to that problem. You have to select the best solution, and then you typically have to defend that solution as well. Okay. When we look at that, those are on page 304. And it says once you identify that you have an ethical dilemma and the human values that can be associated with that, then the process is just like when we talked about critical thinking and problem solving. The difference is the last step of critical thinking and problem solving wasn't that you had to defend the selection. With that, you had to basically reflect on your decision and decide if that would work for future reference or if that was something that needed to be reevaluated. So in ethical analysis, first you identify the problem, you come up with solutions to that problem, you select the best solution based on the problem, and then you have to be able to defend your selection. When you defend your selection, you can explain why your decision is justified. And typically what we do when we're defending it is you want to use things from the code of ethics. That's your best source to defend why you chose to do something. And as a technologist, you always want to be able to defend why you did a particular exam, why you did something a certain way. You always want to stay within the guidelines of the code of ethics and our practice standards. You never want to be so outside the box that your integrity or your decision making could be called into question. Luckily, as a student, that doesn't really fall on you. Identifying the problem, that typically these are things that would be done with a technologist. You guys might come up with the problem. You both might come up with alternative solutions. Like, what do you think we could do? I don't know. What if we try this? Oh, that sounds good. What if we try this? And then together, or the tech might just make the selection the best selection for you. And then they should be able to defend that selection moving forward. When we look at solving an ethical dilemma, again, you have to examine the problem involved with the dilemma. You have to clarify the issue. You have to determine if there's any alternatives that could be done, and then it involves some decision making. Again, this doesn't typically fall on a student. This would fall mostly on a technologist. I can't honestly think of a good ethical dilemma that I've actually been involved in. Most of the things in our field are pretty straightforward and clear cut. An ethical dilemma might be that you have a patient that is a minor, meaning they're under the age of 18, and they confide in you before you do the exam. Female patient confides in you that she might be pregnant, but she doesn't want you to tell her mom. That kind of poses an ethical dilemma in a shortened sense, because you're not obligated to tell the mom, but at the same time, if you don't move forward with the exam and you end up bringing the patient back down to wherever you got them and you don't complete the exam, when the parent asks you why the exam wasn't completed, that puts you in an awkward situation, because you owe it to the patient to some extent to not violate their privacy. But at the same time, you don't really want to lie to the parent about why you didn't complete the exam. The good thing with those issues, though, is depending on what you say, like if you say they wanted her back down there for more testing or something like that, you can share and you should share that information with the attending physician that is caring for the patient. Because pregnancy, I'm not going to tell you that we never image pregnant people, but if you are going to image someone, you want to make sure that the physician that ordered the exam is aware of that, and that they are okay with you moving forward performing that exam. If they're not aware of it, you can follow up with that once they confirm or deny the fact that the patient is pregnant. But you don't ever want to just take it upon yourself and be like, oh, it's not a big deal, I'm just going to do the x-ray anyway, because we're still dealing with X radiation, which still is the variable for the unknown. So you don't ever want to put a patient or the patient's fetus in harm's way. Okay, that might be an ethical dilemma maintaining patient confidentiality. But you're always required to share that information with those that need to know. And I would argue the first and foremost would be the patient's physician. Anybody else really isn't on a need to know basis, other than yourself, because the patient confided in the physician. When we look, they talk about some ethical theories, and they talk about consequentialism, non-consequentialism, social contracts, right-based ethics, principle-based ethics, and virtue-based ethics. Again, not that those aren't important, but we are not going to spend time looking at those. This table 24.2, which is on page 305, now these moral principles are important. These are all things that we aspire to achieve, or that we aspire to uphold for our patients. All right, we have, like the first one, they talk about the moral principle is beneficence, or bringing about good. What we should do is perform actions that benefit others, that you always want to decide and act in the best interest of the patient, always. You always want to act in the best interest of the patient. Not that the patient's family members don't matter, not that the physician or the nurses or lab or anybody else doesn't matter, but your duty is to that patient from the time you get them until the time you return them or let them leave. So you always want to do good for that patient, actions that benefit the patient. Non-malfeasance means preventing harm. Above all, you do not want to harm your patient. You never want to perform or allow an act that may harm the patient. Now, I'm not saying, if we do positions on a patient to get their x-rays and they're in pain, that unfortunately that is common. X-rays are not made for well people. X-rays, if you have a potential fracture, then things like that do cause pain. I'm not saying we're not going to do the x-ray because the patient's in pain, but you don't want to do anything that would intentionally harm the patient. Like if you knew that their hip was broken, you're not going to have them stand up on that leg and they tell you they can't, and you tell them tough. I want you to stand up anyway. It doesn't matter if it hurts. That's the kind of thing I'm saying. You don't want to allow an act that would harm a patient. Positioning, that usually does involve some kind of pain or it's discomfort. That we try to minimize, but we also have to explain to the patient that we need to get the images for the radiologist in order to be able to diagnose. Autonomy is acting with personal self-reliance. You want to perform actions that respect the independence of other people, and the patient has the authority to decide what is or is not done to themselves. Autonomy, unless they have a power of attorney, like let's say you have a patient that has Alzheimer's, and maybe their husband or their wife or their son has power of attorney, meaning that they can make decisions for them. If that's the case, then the autonomy would transfer to whoever the power of attorney is. But if they don't have that, then each patient has the right to decide what is or is not done, meaning they have the right to refuse an exam. If a patient tells you they do not want the exam done, then you have to listen to that. I won't tell you that we don't try and usually talk them into it, as far as sometimes patients are just scared. Sometimes we tell them, I understand, this is scary and you probably don't want to do this, but in order for your doctor to have the proper diagnosis, this is something that needs to be done. So what we could do is try. At least if we try to do it and you're not able, then we can say you tried. But if we just cancel before we try, then that doesn't look very good, because it just looks like you just didn't want to do it. We always try and play cheerleader with the patient and get them to consent to doing the exam. But if they absolutely refuse, then you absolutely have to take their word for that, as long as they have their own autonomy. A minor patient does not have autonomy. the parent or the guardian has the right to say, yes, we do this, or no, we don't. The child screaming, the 2-year-old telling you they don't want it done, they don't have autonomy. Their parents have their best interest, and the parent decides what is or is not done. Veracity means telling the truth. Always be truthful with your patient. There is never a reason to lie to the patient. You always want to be truthful. And sometimes the truth is simply that, I can't tell you. Patients will often see their x-rays and say, is it broke? I know you know, just tell me, is it broke? My response is, I'm so sorry. It's outside my scope of practice to share that information with you. Usually I try and joke and I say, I'm sorry, they don't pay me enough to know those things. That's why we have the radiologist. We have to make him earn his salary as well. I usually try and blow things off with humor, and then they usually say to me, well, I know you know, and I say, even if I did, I'm not at liberty to share that information with you. So telling them that you're not able to is still being truthful, because that goes against our code of ethics. You are not to interpret or diagnose a patient. You simply are to take the images and know whether or not the images are good and acceptable diagnostic, but you are not to interpret those images. Fidelity, being faithful to the patient, performing acts that observe covenants or promises is right. You always want to be faithful to your patient. You don't want to violate their privacy. You don't want to violate their trust. It takes a little bit to build up that rapport with the patient, so you don't want to do anything that would go against that rapport with the patient. You want to maintain that. And the last one, justice, acting with fairness or equity. You always want to perform acts that ensure the fair distribution of goods and harm are right. You always want to be fair. You don't want to base your patient care skills on if they deserve it or not. Every patient deserves the best patient care skills. Every patient deserves for you to follow the ALARA principle. Every patient deserves your respect and your time and your energy and your effort. Okay, so those ethical principles, beneficence, non-malfeasance, autonomy, veracity, fidelity, and justice, are all things we absolutely look to live up to in our profession. When we talk about professional relationships, there are professional relationships towards the patients, a professional relationship with the physician, and a professional relationship with other healthcare professionals. Okay, we often have to deal with the patient, physicians, and other healthcare professionals, because we are a team-based allied health team that cares for the patient. So when we talk about these professional relationships, it's behavior within the imaging that involves entering into social contracts with the patients and their families, with practitioners, healthcare personnel, and co-workers. And it's important to understand the nature of those social contracts. How do you avoid an ethical conflict? What the social contract is basically just saying that you, when you enter into that social contract, by definition, it's a relationship that exists when two mutually dependent groups in a society recognize the expectations of each other and conduct their affairs accordingly. Like, you respect the patient's rights. You respect the fact that the physician is treating the patient. You respect that the patient's family is concerned about the patient. You respect that other departments treat the patient, and that it's not just your patient and you're the only one that deals with that patient. So those social contracts are just basically saying that you understand and agree to be respectful of the other team members, of the patient's family, and act accordingly. As far as ethical conduct and how to avoid it, you have to understand that in some situations it is unavoidable to have an ethical conflict. You have to understand the right thing to do and the wrong thing to do. You always want to choose the right thing to do. And if you're not sure what's the right thing to do, then you should research professional standards of conduct and ethical principles as your guide. So you want to look at those practice standards, you want to look at the code of ethics, and make sure that anything involved in your decision or choice does not violate either of those. If you end up making a mistake, what do? Understand that we are all human and we do make mistakes. And as a radiologic technologist, you are not an exception to the rule. You are still human. If or when you make a mistake, it's important to act honestly and faithfully. Okay, remember, honestly is that veracity, and fidelity is acting in good faith. So you want to be honest that you made a mistake. You want to be faithful and say that you made the mistake. Mistakes happen for many, many reasons. You just always want to try and avoid mistakes. A lot of times mistakes happen because we rush. We try and get through something really quickly. We're trying to get it over and done with, off our to-do list, but that's usually when mistakes happen. A lot of departments have strategies in place to minimize mistakes and prevent their occurrence. There's risk analysis, there's critical event studies, and there's sentinel event committees, right? I would say that in our field, I'm not going to tell you that there are never mistakes made with regard to ethical conflicts, but it is not something that we tend to deal a lot with. In conclusion from this chapter, ethics is basically a combination of societal laws and values. Professional ethics is specific to an occupation and defined by members of the profession at many levels. So when we talk about professional ethics, we are speaking about the ethics related specifically to a certain profession. In our case, we would talk about those related to radiologic technology. So it's a combination of society's laws and values. Ethical dilemmas naturally occur and require a thorough analysis. And then the ethical medical professionals have to possess a keen sense of the role that human values can play in resolving ethical dilemmas that may arise in professional practice, both in dealings with patients and in interactions with physicians and other healthcare professionals. Okay, so always try and be professional, always try to be ethical, always try and fall within the proper practice standards. If you're not sure about something, then don't do anything until you find out what you should or should not do. As a student, like I said, the luxury of that is that you have other technologists that you can fall back on. You have us as far as your program officers, myself, Mrs. Ray, Mrs. Stevenson, Dr. Wyatt. You have us that you can seek out and ask. You'll have on clinical sites, you'll have clinical instructors, you'll have other technologists, you'll have many, many people that you can go to and find out answers or ask the questions without having to do anything that might get yourself in trouble. Okay? And as you go out on clinicals and as you progress through the program, you start to realize what all is involved in our job, in our decision making, and I believe you'll come to find that it's not as gloom and doom as this chapter kind of makes it out to be. There aren't really that many ethical outrages or ethical dilemmas, and a lot of times if there are, it's not really our problem to solve, which is also a nice aspect of that. It's somebody else's issue to solve, so that tends to work out a little bit better. So if you have any questions or comments or concerns, then we will discuss that in our next meeting, and we'll also probably look at some different scenarios where ethics could come into play, and we will also look at that code of ethics. I will put that up for you guys so that we can go over it. The current code I will put up. So any questions or comments or any concerns, please write them down, and I will see you when we meet again.